Overtraining happens when the careful balance between training intensity and recovery time tips too far toward stress, creating a state where the body can't keep up with the physical demands placed on it. This misstep can lead to fatigue, illness, or even injury that persists for weeks or months. At its worst, overtraining can end an athletic career. The process starts with a concept every athlete knows: progressive overload. The idea that pushing the body just beyond its limits will lead to adaptation and growth. But if training becomes too frequent or intense without enough recovery, the body can no longer adapt positively. This process is called the overtraining continuum, moving from acute fatigue to more serious stages that can harm an athlete's performance and well-being. When an athlete trains hard, their body initially feels fatigued, which is normal and manageable with rest. But if this overload continues without sufficient rest, athletes can enter a phase called functional overreaching, a planned period of intense training intended to temporarily suppress performance. When handled well, functional overreaching lets the body rebound stronger than before after a recovery period, a concept called supercompensation. However, without careful management, functional overreaching can shift into non-functional overreaching, where performance stagnates or worsens, potentially taking weeks or months to recover. Non-functional overreaching, if ignored, can lead to overtraining syndrome. Overtraining syndrome is a long-term state of chronic physical and mental fatigue that can severely affect an athlete's life. Overtraining syndrome takes two primary forms: sympathetic overtraining, where the nervous system stays in a fight or flight state even at rest, common in younger athletes training for speed or power; and parasympathetic overtraining, where the nervous system is excessively relaxed, leading to sluggishness and difficulty pushing performance, often seen in endurance athletes. Once overtraining syndrome sets in, recovery can take months or even years. Overtraining syndrome symptoms aren't easy to distinguish from regular fatigue, making early diagnosis tricky. However, one clear signal is a continuous decline in performance despite adequate rest. Athletes might also experience extreme fatigue, mood swings, disturbed sleep, hormonal imbalances, and appetite loss. Psychological signs such as depression, irritability, and a sense of burnout can often be early warning signs. In the initial stages, functional overreaching may only bring slight changes, such as minor coordination issues, mild muscle glycogen depletion, or an elevated resting heart rate. But if an athlete crosses into non-functional overreaching or overtraining syndrome, symptoms worsen, including muscle weakness, immune dysfunction, hormonal shifts, and more severe psychological disturbances. So in some cases, overtraining syndrome can even lead to lasting physiological damage. Overtraining's effects ripple through multiple body systems. The nervous system, for instance, becomes overstimulated, disrupting motor coordination and muscle contraction, problems that can impair sports requiring precision and power. Hormonal imbalances also play a role. The testosterone to cortisol ratio, a marker of anabolic growth, and catabolic and breakdown balance often decreases in overtrained athletes due to increased cortisol and reduced testosterone levels. While once seen as a reliable marker, we now know this ratio only partially reflects the physiological toll of overtraining. Changes in other hormones like growth hormone, IGF-1, and pituitary hormones can also signal stress on the neuroendocrine system. Hormonal responses differ depending on the type of overtraining. Volume-related overtraining may increase cortisol and reduce testosterone, while intensity-related overtraining doesn't always alter hormone levels at rest, though it still impairs performance. No single hormone provides a foolproof diagnosis of overtraining syndrome, so a combination of physiological, performance, and psychological measures offers the most accurate picture. Before physical symptoms surface, psychological changes often appear. Overtrained athletes may lose motivation, struggle with irritability or anxiety, or feel persistently fatigued. But monitoring mood is critical in spotting overtraining early. Tools like the Profile of Mood States questionnaire, which tracks factors like tension, depression, and vigor, can reveal changes that may signal overtraining. Athletes often notice mental shifts before they observe physical symptoms, making these cues essential for timely intervention. To prevent overtraining, coaches and athletes can use periodization, a strategic method of alternating periods of high intensity work with phases of recovery or lower intensity. Periodization cycles can involve short periods of intense workouts followed by deload phases, where intensity is dialed down to allow the body to recover and prepare for the next challenge. Proper periodization allows for progressive overload while minimizing the risk of tipping into overtraining. A common mistake in overtraining is relying on excessive training volume without enough rest. While increased volume can lead to gains, the tipping point into overtraining often comes when athletes, especially those highly motivated, push too hard. Research suggests training volume should be carefully monitored and adjusted to keep athletes from crossing into dangerous territory. Several markers can help detect overtraining early. Some of the most useful include unexplained drops in performance. This is often the most telling sign. Elevated resting heart rate and blood pressure, persistent high values can indicate stress on the body, chronic fatigue, more than the usual post-training tiredness. This includes fatigue that lingers despite rest. Hormonal shifts, monitoring levels of testosterone, cortisol, and IGF-I can provide insight. Mood changes, depression, irritability, lack of motivation, and disturbed sleep patterns are common signals. Monitoring these indicators regularly can help identify early signs of overtraining, allowing for intervention before serious problems arise. Sometimes the best course of action is to step back. Detraining, scaling back, or even pausing training can provide the body with a necessary reset, especially for athletes nearing or already in an overtrained state. Although detraining may result in slight fitness losses, research shows that strength levels can be maintained for up to 4 weeks with minimal exercise. Detraining gives the body time to replenish glycogen stores, restore hormonal balance, and reduce chronic inflammation. The speed of detraining effects varies. Strength tends to decline more slowly, while explosive power and agility drop off faster. Fortunately, the body has ability to allow strength and muscle size to return quickly once training resumes. This effect highlights the importance of planned recovery phases for long-term gains. Overtraining represents a real risk, especially for athletes who constantly push to improve. Avoiding overtraining requires a balanced approach to training and recovery, with careful program design and regular monitoring of performance, mood, and physiological markers. Recognizing the signs of overtraining early on allows for adjustments that prevent chronic fatigue, burnout, and long-term damage. So training is not just about pushing harder, it's about knowing when to step back and allow the body to recover. With the right mix of intensity, rest, and monitoring, athletes can maximize their performance and resilience, avoiding the pitfalls of overtraining that can undermine even the best prepared athletes. By respecting the body's limits and managing stress thoughtfully, athletes and coaches can keep performance on the rise while maintaining physical and mental well being.